This afternoon, I would like to speak to you about a project that we have in Johnson & Johnson. This project is very dear to our hearts. It's called the New Horizons Collaborative. So it was launched in 2014 with some of our partners, such as Elizabeth Glacier Pediatric AIDS Foundation and Partnerships for Supply Chain Management. So what we did was that we identified an unmet need, and really this was the lack of availability of second and third line antiretroviral options for children and adolescents in resource-limited settings. So we launched this program called New Horizons Collaborative. Really, our overall goal has been to contribute towards the 1990 target set by UNAIDS. And we want to do this just to address the gap between the management of children and adolescents as compared to adults who are living with HIV. And by doing this, we want to link about 5,000 children and adolescents to second and third line therapies by the end of 2020. We have two main objectives in the New Horizons Collaborative. So we have on one arm a donation program, and this we do with the Ministries of Health. And then we also have this complemented by a health system strengthening activities using a public health approach. So what we do is really identifying the frontline healthcare workers who manage children and adolescents in the clinics. And then we build their capacity in managing HIV generally, but then particularly in treatment failures, and really building their confidence to be able to switch children and adolescents who are failing therapies. As Dr. Morehouse mentioned, there's some inertia that we see all over in Africa and elsewhere when it comes to really having the confidence to identify these patients, even when the viral load tests are done and it shows clearly that a patient needs to be switched. There's this inertia that we're seeing, and therefore we want to build the capacity of these healthcare workers, particularly frontline healthcare workers, so that they will switch the patients as needed. The donation program itself started after the launch of the program in 2014. So that's when the first patient in New Horizons was enrolled. And we're donating darunavir and etravirine, all the formulations of these products aligned to what the countries would like to receive. And we are doing this program in collaboration with the Ministries of Health. So they really manage New Horizons at the country level. So all children and adolescents up to the age of 24 are eligible to join the program. And as it stands now, the last child or adolescent to be enrolled into New Horizons will be at the end of 2020. And as you enter New Horizons Collaborative, you have access to our medicines and then to our technical support until the child is 24 years old. And then that child is seamlessly transitioned into the national adult programs. We use the operating principles that we use are very strongly aligned to those set out by the WHO, on their guidelines on donation of medicines. So number one, we do not want to give products to a country that doesn't need them. So we want to make sure that the products that we're offering to the countries are needed. And therefore, countries would have to submit an expression of interest. And this is managed by ECPAF. Based on a set criteria, countries are then enrolled into New Horizons Collaborative. We also do not want to create any confusion with the donation, and therefore this is very strongly aligned to the distribution mechanisms that are used in each country for PEPFAR-funded ARVs. And also we are given exactly the same medications in the program as we would if a country was procuring darunavir or etravirine. We launched in 2014 in 4 countries, and Zambia is one of our first countries for New Horizons Collaborative. We have South Africa as well, Eswatini, and Kenya. And over the last 5 years, we've onboarded several countries, and we're now standing at 11 countries, with Zimbabwe, Nigeria, and Cameroon being our newest countries on board. We have developed several tools over the last 5 years. We have e-learning platforms, resources. We have disclosure toolkits, both in French and in English. We've developed resistance, treatment failure resource pages, and we have that at the booth just behind the door at the Johnson & Johnson booth, and please feel free to pick one if you require. We've had several trainings in the countries that are participating, and we do this in collaboration with Right to Care and other partners as well. This is a list of our partners. The ministries of health of all the countries are very integral to the success of New Horizons Collaborative, and we work very closely with the ministries of health. Dr. Mulenga has a lot of experience working on New Horizons Collaborative, and we would like to give him a few minutes just to share his insights about Zambia's journey with New Horizons Collaborative. Thank you.